And already with APT-weighted CEST at 3 Tesla, you can detect cancer, you can detect stroke. However, this is not only APT-weighted CEST. If you actually go to ultra-high fields like 7 Tesla or 9.4 Tesla or even higher, you see that there are many different effects around. So there's not only amide proton transfer, which is APT, but there's also nuclear Overhauser effects from proteins, there's effects of glutamate, amine protons, there's effects of guanylyl protons from creatine. So this is a whole spectrum full of different CEST contrasts. And at ultra-high fields you can make use of them way more specifically. For example, for pH weighting, which is important to detect stroke, right? To have a detectable ischemia. You can take the ratio of 2 peaks, yeah? For example, amine and amide, and use their different pH dependency to actually get a calibration for pH in vivo. And then you can realize a pH mapping. On the other side of the spectrum, there is nuclear Overhauser effects that show a lot of protein content, but also are related to protein denaturation or protein unfolding, but also just higher proliferation. And it's also very interesting to look at these signals in tumors. There you also see that actually they decrease, and at the same time the CEST effects increase. So I would say from ultra-high fields you can learn a lot how the spectrum behaves in different tissues and different pathologies, and then use this information for interpretation of data at clinical field strength. Yeah? So I think it's a very fruitful synergy to do both, and yeah, ultimately either get a high field scanner yourself, or we translate it to 3 Tesla with all the insights we have.